Hello and welcome to Dialogue. 2 weeks after China relaxed measures against COVID-19, Beijing is emerging from a recent wave of infections from the less deadly Omicron variant. This shift of focus from infection control to case treatment came after 3 years of protective and control measures that undoubtedly saved millions of lives. What prompted the easing of measures? What has been the effect? And what does the road ahead look like as China focuses on economic recovery from the pandemic? To find out, I'm joined today by Andy Mok, Senior Research Fellow at the Center for China and Globalization, Maria Cavolo, author and CEO and Communication Group, and Zoon Ahmed Khan from Belt and Road Strategy State. That's our topic. I'm Xinduo. Welcome to the discussion, Zoon, Mario, and Andy. We have been in this new wave for about 2 weeks, in particular in big cities, Beijing or Shenyang, where Mario, you are based. So I want to start with you, Zoon. What's your observation of the past 2 weeks? So, do you know anyone who got like a bad cold, who got infected, or yourself got infected? What's the recovery like?
I'm laughing because basically for me personally, I tested positive 2.5 weeks ago. And absolutely everyone I know or the people they know, I mean, I think this is something we can also see in other cities how it is. But for Beijing, people have definitely tested positive. It was basically 2 days of more severe symptoms, I would say, high fever and maybe some body aches. And then after that, it gets better. So definitely, I mean, it spread quite fast. People started showing those symptoms. They were taking home testing kits, helped a lot in gauging how fast, I mean, they are recovering, whether or not they are COVID positive or negative. And in general, we saw that a lot of restaurants have temporarily closed because their staff caught COVID. Many offices, I mean, they were required to, at least if their employees are not feeling well, take a few days off and then see how they're recovering. So it has spread quite fast. And I think most of us, I mean, we are obviously recovering now, but it's quite a situation to be in. And I'm glad that we were able to, arrange the required medicines. And there was a lot of communication about, what are the basic things we can do staying at home. What kind of treatments are working, how much we should rest, etc. So yes, it's quite a 3 weeks of a lot of new developments that we are having to deal with.
Mm-hmm. Well, Andy, you are also based in Beijing. What's your observation? What's your experience?
No, Tsinghua, I caught COVID last week, and I can say that, like what Zoon just shared, everyone I know has caught COVID here in Beijing. The numbers I've seen is that within a week, more than 70% of people in Beijing have gotten infected. Another statistic to share is that the reproduction number, or how infectious these variants are, the reproduction number is 20 versus the original Delta variant of 2. So this is an incredibly infectious variant that has spread so quickly through Beijing. But the good news, which I can attest to personally, is that many friends have said that they've had worse hangovers. So I had a low fever, I had a headache and a sore throat. Luckily, ibuprofen really helped a lot. And really by day 3 was feeling better. That being said, there was a fair amount of inconvenience because, again, this variant spread so quickly that we all living in Beijing depend a lot on delivery people for carry out, for groceries, for other things. And many of them were sick as well. So for a couple of days, it was difficult to get deliveries. But I would say at worst, this has been an inconvenience. And I feel like I'm living in 2 different worlds here, because if you read Western media, you hear this catastrophe, COVID nightmare. And the reality here on the ground is that, yes, it's not fun to be sick. but relatively mild. Mostly everyone's recovering in a few days, and life is really getting back to normal here. And I've been telling people, enjoy the quiet time while you can, because I think Beijing is going to be back to bustling metropolis before too long. It already is.
It already is, agreed.
Already is. Yeah. Mario, how is the situation in Xinjiang, in northeastern part of China?
Thank you, Qindua. The situation here in Shenyang is a clone of a clone of a clone of the stories that you just heard from Rune and Andy. People don't think too often about the second-tier cities like Shenyang, where I am, but I noticed immediately we were at the front right along with Beijing. Don't know why, right? Other cities are not hit as badly yet, but I can tell you the exact same words, that everyone got COVID. And you know, I'm here 20 plus years with a WeChat account. I've got thousands of followers all over the country, you know, people I'm in touch with, right? People who live in other cities, plus a big community here in Shenyang, foreign and Chinese. And when I say everyone with a capital E, you know, literally everyone, and everyone that everyone else also knows got COVID and got it within like 3 days. Now, this is actually shocking. I don't like the fact that, I want to use it to bring up a point where, as usual, Western media has a choice. They will report anything and everything regarding China in the worst possible light, or they will report it reasonably and with empathy and compassion. Well, they'll never do option number two. So and I hear people complaining that the pharmacies, for example, ran out of medicine. So China can do no right no matter what. Well, excuse me. In the United States right now, there's a massive shortage of medicine for people because of a wave of flu and RSV and COVID happening there, especially for children. Folks, that's not a reason to condemn the United States. That's just a reality of a horrible, nasty flu season, sick season happening in the United States. And here in China, of course, the same thing is happening. Now, who expected 70% of a city of 20 million people? Did the Chinese government, when they opened it up, just think they were going to get hit that hard? So they say, oh, they didn't stockpile the medicines. No, folks, they did stockpile lots of medicine. They did lots of preparation, but nobody expected 70% of Shenyang, which is 8 million people. That's 5 million cases in one city. In Beijing, 70% of 20 million people, or however, whatever the population is there. That's 14 million people within 5 days. Just in these two, you see what I mean? So no matter what, there's going to be challenges and difficulties. These are, I refuse and will not allow this to be reasons to continue to demonize China, who has done better than any country on the planet in dealing with COVID. And I know, Qindua, what you're going to say next.
We'll come back to that about the government preparation or the government change of policies. But before that, you know, Andy, I have some figures actually to echo what you have said about the return to normal, probably faster sometimes than our expectation. For example, according to the Beijing health authorities, you know, the number of people visiting fever clinics in the city reduced on December 21st by 11% than a few days back. The traffic flow in the subway in Beijing has increased 1 million this week than last week. And the delivery service obviously has improved greatly. That's based on, I think, personal experience. My experience is like this. Basically, whatever you order, it will be arriving on time. Very different from last week, let's say. If you look at the Baidu search data, online searches for the word fever by people in Beijing peaked on December 12th and then started to decline. So Andy, my question is is it safe to say we are nearing the end of the wave of infection in Beijing?
It certainly seems that way, Tsinghua. So again, we're almost talking about two different diseases here. The original variant of COVID, which China did such a great job of protecting people against, and this latest set of variants, in that, again, highly infectious, but pretty mild and very quick to pass through the population. So certainly, I think Mario makes some good points that the Western media is really indulging its worst ghoulish tendencies here by focusing on some of these extreme, unfortunate events. But the reality is that this wave is passing through very quickly. I think that China already is bouncing back economically, socially, much more quickly than most of these Western observers believe is possible. And, one point about the media, I know we're not here to talk about the foreign media, but that they've gotten it so consistently wrong from the beginning, where COVID cannot be managed through these strict lockdowns, which China proved them wrong, to the disastrous failings in Shanghai, which actually turned out to, again, be a gross exaggeration, now to this latest, again, ghoulish fascination with, some of the extreme events here, again, that are completely missing the point and are gross distortions. So I agree with you, Tsinghua. Those numbers absolutely jibe with what I'm seeing here on the ground in Beijing. Things are rapidly improving, bouncing back, and I think we're really poised for a really, really much better 2023.
So, Zoon, it seems like people, in particular young people, you see they are back in the streets and lining up in front of the restaurant to get seated again. So ready to celebrate the arrival of, this is the season of the holidays, right?
This is exactly. So I think, the numbers that we see, the official numbers of how Beijing, from 2 weeks of relative caution, I would say, to coming back, restaurants are opening again. There is a lot more optimism. People are moving, going outside. Barber shops are open again. The malls have a lot of people. So definitely we see that, that prediction, or the way in which Western media was covering the situation in China, especially in Beijing in the first few days. They according to their estimates, this could have been a very long process, but we see people bouncing back. We see people helping each other as well. So a lot of, in a lot of these groups, people are discussing, okay, if you've recovered, but you still have a cough, what can we do? So there's a lot of support as well to help people fully feel the way they were pre-COVID. And I think, just the fact that actually now the perception is this was more like a flu, and once you've recovered, people are able to, bounce back the way they did. So the other thing is, yes, this week, like you mentioned, the deliveries are also just the way they were. And yeah, so generally Beijing is a good example for how we can expect other cities as they peak later on to reemerge and to recover fully. So it's a positive outlook, I would say.
So let's move on a little bit to the, if you look back a little bit, Mario, I know you have followed the Chinese policy very closely from the previous, we call it a dynamic zero COVID policy, rather, I would say strict in terms of this control and prevention. And then actually in the middle of November, the government released the 20 new guidelines, starting to basically optimize some of the measures. Some people would say relaxation, a little bit relaxation of the measures, but it signifies change of the policies. And then in early December, there were 10 new measures. So to further relax those measures, so we are seeing a quick change of the situation. So tell us, why the Chinese government choose at this particular point of time, November, December, to basically make a change of their policies? Is it because the virus is so transmissible, just almost impossible to continue to prevent probably the spread of the virus, or because there are frustration, obviously, in particular young people, they say we have been through this for 3 years, we need some change, or because of other reasons maybe?
Qindua, the question of why, first of all, okay, that's point number one. I love the question. It speaks to the absolute core of what we're all dealing with. And number two, unlike, again, how the ghoulish Western media wants to report it, this was not a sudden decision. This was not, oh, the Chinese government flipped, okay? You just referenced a date way back in November. It was November 11th when the press conference was held that the first set of 20 points, which were a substantial relaxation of the policy, was first announced. Now, unless I'm mistaken, that was like 33, 34 days ago. So that this was not sudden and unexpected. It was over a month ago. It was in the works to do that. And the question is to say, well, why was it? Why did it happen? Why did they make that decision? Well, there had been, up until that time, the government's meticulous analyzing of the data, and of course, they're going to go slower than everybody else because they're responsible for 1.4 to protect the health of 1.4 billion people. Please excuse the Chinese government for going a bit slow on that because pretty serious responsibility. I'd go a little on the slow side to be safe too. So, but they knew by November 11th that they could substantially relax the restrictions and they announced it. Why, Qindua? Why? Because previously, Hong Kong and Taiwan did not have a good experience when they had big breakouts. But Shanghai on the mainland confirmed the latest variant mildness, very low death rate, very low severity. Subsequent infections, I wrote this up in China Daily article, yes, that was published yesterday. Subsequent outbreaks that took place in Beijing, Zhengzhou, Chongqing, and Guangzhou further confirmed. They were in September, October. So by November, the Chinese government was able to say, wow, we got a good situation here. Finally, after 3 years, we can relax the policy. We do have a milder variant that's hitting our people. We can relax the policy. And that's why they announced it. What went wrong after that? Because there was some people pouring out on the streets. There was a few protests here and there. There was the Foxconn Zhengzhou situation. People were upset. Why? Because they announced the policies, but it didn't trickle down fast enough to the municipal level. You know, everybody on the municipal level, God bless the government people, but they're like, whoa, we're a little nervous to start relaxing the policy. So they didn't do it as quickly as they should. People expressed their frustration. So then on December 7th, the government reiterated, no, it's okay to open up. It is okay. And then they really pushed it forward and said, yes, we're going to open up. And they did that on December 7th. I'm not, you know, when I say opening up, it's a weird kind of language because it was just a relaxing of those three key restrictions. Stop broad testing, stop app health tracking, and if you get sick, go home and you don't need to go to the hospital. This has worked out to be very, very true. The surge is happening, it's being handled, and here we are.
Mm-hmm. Well, Andy, it seems like there are enough reasons probably for the government to, promote the government to change its policy direction. As Mario mentioned, it's becoming mild, very different from Delta at the beginning stage, let's say. And also it's extremely transmissible, and probably it's not that cost effective to continue to pursue this zero COVID policy. And also you have to take into consideration people are tired of, people are looking forward to changes in the direction there.
No, absolutely, Qindua. So this is not only a public health crisis, it also is an economic crisis, and it also is a public opinion challenge. So we are fortunate that viruses mutate, they evolve, and COVID has evolved to become much more transmissible, in fact, incredibly infectious, but much, much less lethal. So I think that, again, if you're going to make decisions based on science, based on empiricism, the right decision is to change your policies from prevention to treatment of the most severe cases, which is what we've seen China do. So that being said, I think it's important to acknowledge that deaths have gone up. And what is less visible, though, is that the prevention policies are very visible. We see the testing stations, we see the dabai, the people in the white hazmat suits everywhere. But In fact, now the emphasis is on increasing the number of ICU beds, changing policies at hospitals, making sure that people that are sick enough to require hospitalization can actually get access to hospital resources. So this is not something we can readily see, but is also happening. We're also seeing supportive economic policies as well, because again, this is not just a public health crisis, it's an economic crisis. So we're seeing those developments as well through the Central Economic Work Conference, other announcements. So clearly, we're in a new era here. And the good news is, again, the virus is mutated and the government is acting based on science, facts, and balancing really a complex public policy challenge.
Policy challenges. Zoon, yeah, go ahead.
I just want to add a few points to this. So I mean, Mario and Andy have covered a lot of important aspects of the policy. And I think I'll briefly add that, you know, indeed, the change of policy was announced in November. And actually at that period, people following Chinese social media also saw that there were many videos of the isolation centers for asymptomatic people going viral, where they were, you know, feeling not that harsh of symptoms. They were dancing, they were having, they weren't suffering seriously. And on top of that, they were communicating to their millions of followers on Chinese social media that now the health workers are telling them, don't worry, it's not a big deal to get COVID. It is a flu. So that communication was very different, you know, from the stronger variants of COVID previously, that now the virus is not as dangerous, and it's okay if you catch COVID. It's nothing to be embarrassed. You know, the feeling, I mean, of having tested positive as if it's something bad, that was changing a lot. Secondly, I think what we did see was that the isolation centers, the day the policy, the change was announced, already 10% had been converted into ICU units. There were hundreds of thousands of doctors and nurses who were recruited by then to be able to prepare for the surge of cases. So what we have moved towards is obviously from avoiding COVID, you know, reducing the number of cases, instead to COVID resilience, I would say. And the timing couldn't have been better. The vaccination rates are very high. People have better idea how to treat themselves at home, and also people are very responsible. So even if people are asymptomatic or they have very mild symptoms, everyone I know, I mean, they try to stay home, away from others, self-isolated, in order to make sure that they don't further the spread. So in that sense, it's also very important to understand the mindset of people here, that they are very cautious, they take responsibility themselves. We do not need to report since about 3 weeks to our communities if we've tested positive, but people are choosing to make sure they follow a certain protocol and a certain sense of caution prevails. So these are also important things to recognize, that that transition, and people have access to basic medicines. There was a bit of an issue, but in a few days we were able to access the medicines required. So I think Beijing definitely sets a very good example, and maybe Shenyang as well, where Mario is, that others that are yet to peak, it's no need to panic. It's a transition, and it's one that you can make in a matter of weeks.
We'll come back to this a little bit later. Mario, I mean, I'm thinking of you know, different approaches. You know, the Chinese approach previously, zero COVID policy, and then there's a change of direction gradually to relax, and then when it was the virus is much less lethal at this point of time, they choose to change. But if you compare this approach to, say, some other countries, including the US, at the very beginning, it's like a herd immunity. And you see the suffering of the people, the loss of lives. And, you know, even in the ICUs, some of the nurses, some of the medical workers refused to work or give up their jobs because the situation was so tough, so challenging. You know, compared to the different approaches, I think the Chinese approach probably was okay, to say the least, and it's much probably, you know, though yes, we are losing lives, but it's much better than all, you know, the you know, open at the very beginning.
Tsinghua, I'm going to tell you right now, I'm going to read I wrote on Twitter this morning, and it speaks exactly to what you're saying. What you will never find in a Western media article about China's COVID policy, here's what it is. Wow, it was tough and often chaotic with plenty of mistakes, but I am blown away. They saved the lives of millions of parents and grandparents for their children, and no other country did that. We'll never see those words in a Western media article about China. China waited by waiting, and this waiting, this period of zero COVID, what strikes me is how reflected in the Harvard and Edelman trust and satisfaction surveys for 2020, 2021 shows again, this country rated #1, always alongside Singapore, as a country where the government and the people together understand that they made a sacrifice. No one denies that it was a sacrifice. No one denies the economic damage. It was a sacrifice, which means policy and sacrifice and civic duty together, the government and the people, to accomplish what for 2.5 years? What I just said. And the Western media just won't acknowledge it with admiration, that millions of parents and grandparents, including mine, my mother-in-law, who's still here for her 11-year-old grandson. Congratulations, China. And this is because China held tight for 2 years, okay? This is what they did until now. Other countries, for a variety of reasons, primarily the politicization of the whole topic, the politicization of the pandemic. This was a disaster, and it cost lives. It cost lives, and it's a tragedy for all of mankind. It really is. But here we are now. China continues in its way right now, leading the way. We are leading the way in the result that we're getting right now.
Mm-hmm. Zoon, since the Spring Festival, the biggest festival, is upcoming, we expect still a lot of people will be on the move. So caution is still the word for some time to come?
100%. I think caution is still the word. What I've noticed, I actually asked a few of my friends whose parents are living in villages or smaller cities where the virus hasn't hit yet. And many of them, they've already sent their parents basic amount of medicines just to make sure once they start reporting cases that they do have access. I think this is something people are doing. Many of them are not sure if they will go back home because it just depends on how the situation evolves in the coming days. That said, I think people definitely realize that even if it's a mild variant, people who are older, we need to be more careful about them. And I think that will increase the possibility of people voluntarily choosing not to travel during Chinese New Year. But I think obviously people, we can't, as we've mentioned before, we cannot predict. We could not have predicted 70% in a matter of days would be how many people tested positive in Beijing. This is a very contagious variant. And I think because of that, people can just try and take personal precautions, encourage older people to get vaccinated, and maybe continue to wear masks. That's the best we can possibly do. And also, I will add that maybe what we need to do is help people prepare the medicines they require. I think this is something that other cities are learning from. There was a shortage in cities that were hit earlier, and this is something that we need to be more cautious for. But let's see. We still have a few weeks ahead of us. Yeah.
Well, on that note, we come to the end of today's discussion. Many thanks to our guests. You can also find us on the CGTN app on YouTube. I'm Xu Xinduo. Thanks for being with us. See you next time.